Hey guys, Dr. Tyler here. We are going to be doing an upper back, chest, and shoulder video today. This is going to be a really good video, not just for that area, but the entire spine. The things we're going to focus on are things that cause our bodies to slump forward, which can cause a myriad of issues. So if you struggle with headaches, tension headaches, if you have posture issues, posture, low back pain, if you got any kind of rib pain coming around the front, if you have chronically tight issues on your chest, if you have shoulder issues, elbow issues, wrist issues, hand issues, carpal tunnel, anything down your whole extremity here, that can be due to a long term of the body stooped forward. So this is going to be important for you. When it comes to your posture, we need everything coming down the gravity line. So if my chest and upper back are chronically tight, it causes my head to lean forward. Every 10 degrees forward is 10 more pounds of pressure that sits on my brainstem. And you know that brainstem controls every single function in your organ systems and a lot of your cell and tissues. But it also does as well when I'm stooped forward, I'm loading my low back. So over time that can cause a lot of low back issues. So taking care of the middle part of your spine is going to be essential in total health. Now, a couple things to remember, we say it in every single stretch video, be consistent is number one. Doing stretches every once in a while or just when it's tight or painful isn't enough to break patterns and make long-lasting changes. So make sure that you are consistent, finding a way to implement these things in your daily routine. I always say it's like breaking a bad habit. If you were trying to quit smoking today and you quit today and then do it tomorrow and then try to quit the next day, you didn't make any progress. It's the same thing with different patterns in your body. You need to be consistent in order to make long-lasting changes. And second, make sure that you're not starting too strong. If you're doing stretches for over 2, 3, 4 minutes and you're sore or you're hurting more, you're doing too much. So bring it back a little bit. Do it more like exercises. Do 3, 4, 5 sets of 7 to 15 seconds and then work up as your body gets looser and better and more consistent with everything. Next, we're going to do the standing wall bicep stretch, and this also works your chest, and we'll show you different angles to work both your bicep and your chest. All you're going to do is put your hand straight back flat on the door, and you're going to lean into that wall almost like you're trying to go 180 degrees back. And then once you get to that point where you can't go any further, hold it there for a number of seconds. In that same doorway, you can continue to stretch your bicep, but also your chest. All that's going to be different. For that bicep, you were pretty straight across. For your chest, what you're going to do is put that open forearm in the door, and you can start level 90 degrees. Same thing, lean forward or even step forward. But to get different stretches, keep your forearm just like this. Go up higher. That's going to work higher on your chest muscle. Lean forward into that. You can go lower, and that's going to work more into the lower part of that chest and shoulder. Or you can go straight 90 degrees. So work different angles, and this is going to stretch your biceps, your shoulders, and your chest muscles. So the next stretch that we're going to do, we have Dr. Makayla helping us out, is the child pose stretch. So what you're going to do for the child's pose stretch is you're going to be on your back of your legs, and you're going to lean forward just like Dr. Makayla is. You're going to put your arms as high as you can, and then you're going to duck your chest and your head down towards the floor, and that's really going to open up your shoulders. This is also, once again, a great stretch for your low back. It's also adding in stretches on your bicep muscles, on your neck muscles. This is a great all-around stretch, just like any yoga pose is. Next group of stretching is called the TYW stretches. So what Makayla is doing right now is the T stretch. All you have to do is lay on your back, stretch your arms out like you're doing a T. And then what you can do is transition into the Y, putting your arms up like a Y, and then go to the W. And this is, once again, going to stretch not only your shoulders, it's going to stretch your chest, your upper back, your bicep muscles. She's going back to the T. So now what you can do to add more into the stretch is you're going to lift your chin up. So she lifts her chin up towards the ceiling, and that adds more stretch, especially into the chest and shoulder muscles. And then stay with the chin up and do a Y, and then a W. So adding to the floor exercises, this is just a trunk rotation exercise. So you'll bring one hand over to the other hand and go as far as you can. And what this does is it stretches a lot of your rotator cuff muscles. It also stretches your chest muscle and a lot of your upper back muscles. So this next great yoga pose works on your chest, shoulders, chest, upper back, rotator cuffs, and your neck muscles. It's the cat-cow stretch. So she's going to start with the cat and then work down into the cow. And you can do this over and over again. You can hold stretches at the top and you can hold stretches down at the bottom, or you can do them in repetitions. Now this next stretch called the wall angel is one of the best stretches you can do for your shoulders, upper back, chest, bicep muscles, and really your whole upper extremity. So we're going to do it two different ways. And the first way is the simplified way. You're going to put your heels, butt, shoulders, head on the wall, and then bring your heels out just slightly, just a few inches. Then you're going to put your hands down like you're doing a snow angel. So the first route is just sliding your arms up the wall like you're doing a snow angel and going all the way to the top and then all the way back down. And you can do that in repetitions. Also, the slower the better, because it builds some resistance strength and really does a good deep stretch on those shoulders. Now the second way is a little bit more advanced. Start the first route and then work up to this route. All that's different is heels, butt, shoulders, head on the wall, feet out just slightly. You're going to start your arms down just like that snow angel, and you're going to work your arms up until you feel any tension. So right there, I feel a little tension in my chest. Hold there for about 10 to 15 seconds. After 10 to 15 seconds, come back down to neutral, work up. Should feel a little bit further along, and this is where I feel tension in my shoulders. So I'll hold here for 10 to 15 seconds, and then I'll come back down. I'll work up again, try to get a little higher. Right here, I feel tension in my left shoulder, so I'm gonna hold here and then back down. And you're gonna do that repetitively until you get all the way up to straight up and down. And you can do this exercise 3 to 5 times, however many times you need to, and it's gonna really open up your shoulders, upper back, and chest and neck. All right, we've got Dr. Cody for the next set of stretches. So this is gonna be the trunk rotation stretches. Just a different route. You're gonna get in that kind of cat-cow position, and then you're gonna reach one arm across your body like you're trying to grab your opposite rib cage, and he'll do the other route here so you can see it from this angle. Same thing, get to that end range of motion and hold that position. This is also a great stretch to do in repetitions. Another route to do this stretch, if you're struggling to do that one, is just acting like you're putting your elbow toward the ground. So instead of reaching around, you just turn your trunk and then try to put your elbow on the ground. And this is another great stretch that works not only your shoulders, it works your chest, it works your whole upper extremity and your lower back. So this next stretch is just another cross body stretch. This is the one that we all have known for a long time, just like in high school. All you're gonna do is reach one arm across, and then you're gonna put the other elbow locked in, and you're gonna pull as tight as you can towards your body, just like Dr. Cody's doing. You can also do some trunk rotation while you're doing this, just to work more and more muscles. So this next stretch is a shoulder girdle stretch. It also stretches your shoulders, your chest, your biceps. So you're gonna work all 4 motions of your shoulder. So Dr. Cody's gonna start with external rotation. So really you put your arm in internal rotation and then you work it externally. And then from there you go from external to internal. Now he can do internal and external rotation from a different angle. And you're gonna do this in repetitions. This isn't a great exercise or stretch to do in holds. This is really good to do in repetitions. And this is gonna really help if you've ever had any shoulder girdle issues, rotator cuff issues, or just really tight shoulders. This next stretch is really good for the shoulders. It's called the Apley's or scratch test. So what you're gonna do is raise your right arm and you're gonna bend it down like you're touching your upper back, and then you'll bring your left arm and then go opposite way. So you're doing opposite motions. And what you can do is hold that stretch here if you're able to interlock your fingers and hold tight. Some people can, some people can't, depending on old injuries or how tight and chronically tight those muscles are. Dr. Makayla is going to turn to the side here. It's really important to be standing up very tall during this stretch, because when you lean forward, it's actually doing the opposite of what we're trying to achieve and creating a weird postural stress. So make sure you're standing up really tall. And then she'll show you from the other angle, different arm. So bringing that left arm back, opposite arm upside down, reaching as far as you can. If you can touch the fingers, that is a goal to work up to. So another great stretch for your upper back and your lat muscles. This is also good if you have rib pain or even low back pain. You're going to put one arm over like a ballerina and lean to the side. And you're going to hold that at in range of motion as long as you can, 10 to 15 seconds. You can also, like Makayla here, even do slight rotations. And then add to a piece at the end is you can grab a good light hand weight, and that will help pull you further down, but also keep you stable. Another old school move, but still very effective, is the crossbody swings. So what you'll do is interlace your arms down at the bottom, or you can grab your elbows as well. And all you're gonna do is lean forward and you're gonna swing your body side to side, trying to just activate your trunk, not your low back. And then Dr. Makayla is gonna show you from the side angle. Really important, once again, is making sure that you're keeping your upper back straight, not slumping over too much. Because if you slump over, Doc, it will put a lot of extra stress on the low back, which can cause other issues. And so working the trunk just like so. So this is a good stretch to do. You can do this at the gym, but you can also do it at home. Just grab something like this, like a broom. This is called the overhead stretch. So all you're gonna do is almost like you're doing a clean move, but you're gonna just hold that as wide as you can. And you're gonna bring it up over your shoulders and then let your arms come back. I have a bad right shoulder. That's why my right shoulder doesn't move as well. Now this is more of an exercise than a stretch, but this is gonna get really good range of motion in your shoulders. Another old school but very effective move is just doing arm circles. So you can put your arms straight out and do forward small circles, then backwards small circles. You can work a little bit wider, do bigger arm circles, backwards and forwards. And then you can do very wide circles all the way through your range of motions, forwards and backwards. And these stretches are really gonna help if you almost put a time limit to it. Do them for 10 to 15 seconds at a time in continued motions at different angles. This is the most important concept to know from this video. This is called upper cross syndrome or postural syndrome. So if you find yourself stuck in a forward head posture, your shoulders round forward, you get rib pain, if you get headaches, if you get neck pain, even low back pain, really if you start to see this hump starting to be created on the back of your neck into your upper back, if you feel like your body is just stuck forward, you might have upper cross syndrome or postural syndrome. A lot of our society does because we're so used to phones, computers, leaning forward for a lot of our jobs. Most people do have this, just haven't been able to take care of it properly. Why this is so important is all you have to do is stretch and strengthen different muscle groups. So looking at it from the front here, from this cross here, right here, we start to get really tight chest muscles and we start to get really tight upper back muscles. And that is what pulls your body forward. Now what keeps your body from going back to normal is weak here. So we get really weak neck flexor muscles and serratus muscles, which are some of your rib muscles, and we get really weak lower scapular muscles. So how do we correct upper cross syndrome or postural syndrome? The number one thing you need to do is stretch the tight muscles here and here. A lot of this video is explaining how to stretch your chest muscles, your SCMs, and also your upper back and upper shoulder muscles. It's important to look at our neck video as well because a lot of these stretches are connected to one another. After getting chronically muscles loosened, you can start adding in exercises to strengthen your neck flexors and serratus anterior, which are important, but the most important is right here. Your lower scapular muscles, your rhomboids, your rotator cuff muscles are the most important to hold your body up erect. So focusing on this part right here, strengthening your lower shoulders, your rhomboids, infraspinatus, rotator cuffs, and your lower trap muscles. Doing row exercises is very important. So these are a bunch of different ways to do row exercises at the gym. So pause here, take a screenshot, make sure you check these out. These are really great, but you can see every single motion is working the lower shoulders, not the upper. The upper shoulders are what need to be loosened. I do want to bring attention to this one right here, the cable row. The best way that you can do this at home if you don't want to do gym exercises is invest in some exercise bands. Get bands that work different strengths in pounds and different resistances, and you can do this at home. You can do this seated, you can do this standing, and you can see how he's pulling that cable down towards the lower shoulders, and you can pull those back like he is, and you can do those in holds, you can do them in repetitions, and that is going to strengthen the lower scapular muscles. Another great exercise you can do at home is the fly move. You can also do this at the gym. They have specific machines that work these muscles doing the fly motion. But if you've already invested in those bands, you can also do this at home, doing that fly motion backwards and then doing a slow resistance move back forwards to build extra strength. Another great exercise to build lower scapular strength and your serratus anterior strength is the scapular push-up. You can see in this video that the woman is not doing a full push-up. She's doing just enough to cause her scapulus to rotate and then coming back up. And once again, you can do these in sets, not in stretches. So doing 3 sets of 10, working up, or less or more depending on what you need. Another great exercise to work your serratus anteriors. You can do this at gym or home. It's called the dumbbell pullover, or really whatever you want to use pullover. And all you're going to do is lie flat and have enough space to bring your arms over your head. If you go to the gym, this is something you want to start low with and weight and work up to, but you can also use any kind of household item and do this as well. Another great exercise to build lower scapular and serratus muscles for your upper cross syndrome is the dumbbell rotational punch. Once again, you can use this at the gym, but you can also do this with household items. I would very much encourage you that if you are struggling with upper cross syndrome or postural syndrome, to dig a little bit deeper, especially on the exercises. There's so many different kind of exercises to target specific muscles. So look back at that chart or Google it and find the specific muscles that you need to target more to break that pattern. But like I said, make sure that you start with the stretching, loosening, and reducing chronic muscle tightness is going to be the first step, and then adding in exercises. Tools you can use for tight muscles across the board is a TheraBall or a lacrosse ball. Now we do keep these in-house, but you can also find them on most websites, Amazon, Walmart as well. But what's so good about this tool is it has little divots in it and it's a very solid ball. So what you can do for those tight muscles is find a surface, a wall, a table, on the ground, and push this into those tight muscles. Like if I were working the chest, I can push it into these muscle beds and push it really tight, or I can get against a surface and lean into the muscle and hold it for a few seconds in order to help release those muscles. One of the best tools that you can use for your upper back tightness is a foam roller. Now you can find these at our office. You can also find them online, Walmart, Amazon, anywhere you need to. They're better if they have little divots in them. But how you're going to use this is you're just going to put this at the bottom of your T-spine and you're going to lay back on it and just roll it up and down your T-spine. Now, in order to get a little bit of different movement, you can put your arms over your head. This is going to open up the shoulder blades, dig in a little bit deeper. But this foam roller is going to help release muscle tightness, hit trigger points, and sometimes it can help set ribs back in place that are a little finicky.